Welcome to the Western Health Advantage Open Enrollment webinar prepared for the County of Sonoma. The annual open enrollment period has been extended to April 10th as a result of the COVID-19 situation. Please note that all changes will be effective June 1st of 2020. My name is Lauren Bayat. I am the Sales Account Services Manager here to present the Western Health Advantage webinar for you today. We've got some exciting changes happening this year, so we wanted to make sure we highlighted them right up front. The first one being the plan pricing. We were finally able to get our rates to a place where they were below the employer contribution, which means that all three plans, no matter which plan you select with Western Health Advantage, is now a $0 cost plan for you and your dependents. We've also enhanced the deductible HMO plan where we've lowered the deductible and out-of-pocket maximums on that hospital services DHMO plan. Lastly, we wanted to make sure we highlighted access to care with more than 1,000 providers in the North Bay region, with 82% of those providers accepting new patients. So especially in these times, we know it's very important that you're able to get in and access care when you need it. So we'll make sure to highlight access to care and how you get in and how easy it can be to select a doctor. We are proud to be a local business based out of Sacramento, operating in 9 different counties across Northern California. Western Health Advantage was started 24 years ago by a coalition of doctors, hospitals, and medical specialists that wanted to come together to create an alternative to the typical HMO. And really what that means is that these doctors are the ones calling the shots on your care and referring you to the specialists that you need. So we as the health plan do not step in the way of that. We let the doctors treat you as they should be and putting the referrals through to the specialty care that you need. We also, because we're local, we've got our whole member services department local under one building based out of Sacramento. So when you call into member services, you are reaching somebody that lives and works in Northern California just like you do. It's been a really successful model where we've grown over the last 24 years, up to over 107,000 members currently. We are owned and sponsored by Dignity Health and NorthBay Healthcare, and look forward to working with the County of Sonoma for many future years to come. Another feature that lends itself to our successful business model is the fact that Western Health Advantage is a community-rated plan. This allows WHA to maintain a medical care ratio of over 90%, which means that for every premium dollar we bring in, we turn 90% back over into the patient care and member satisfaction, and not to appease our shareholders. By operating on a single-digit expense, we can also maximize our funding to be returned to the providers as well. With the community-rated model, our rate stability and predictability is a wonderful feature to have when you're going through renewals each year. This year, we were really excited to be able to bring our rates down to offer $0 cost coverage on all 3 plans. And given this rate stability, each year when we have our rate increases, they're typically in a single digit arena because we don't actually apply member experience, which is the claim experience, to the renewal increase. And that's part of the community rated model that we have in place. This map shows our service area, which is the 9 counties that we operate in. Out here in Sonoma County, we have a large, extensive network of providers to choose from, which we will get into details on the different medical groups that are offered. And also you can see here that we've got 4 major hospitals for you to access in Sonoma County. Western Health Advantage has 6 different medical groups within our network. Out here in Sonoma County, the 2 major medical groups you would access providers from would be Meritage Medical Network or St. Joseph Health Medical Network. And North Bay is in Solano County, which is close by. The other networks are mainly out in the Sacramento region. Our facilities in Sonoma County, as you can see, are Healdsburg District Hospital, Petaluma Valley Hospital, Santa Rosa Memorial, and Sonoma Valley Hospital. We offer lots of access to providers and choice within the providers, which we will talk about in a few slides from now. WHA is an HMO health plan, which means that when enrolling with Western Health Advantage, you are required to select a primary care physician, or PCP, within one of our medical groups. When you need to seek specialty care, that PCP will refer you to the specialist for treatment. We offer choice and flexibility to our members by way of the Advantage Referral Program. This program allows members to be referred to specialists in not only the medical group that their PCP belongs to, but any of the other medical groups in our network. For example, you could have a St. Joseph PCP and be referred to a Meritage Medical Network specialist. All you have to do is go to your PCP and request which specialist you'd like to be referred to if outside of the medical group. And your PCP will put that referral through behind the scenes, so it in some ways feels like a hybrid PPO where you have not only the choice of the specialists within your medical group, but all of the other medical groups in our network. The best way to search for a provider is through our website, which is choosewha.com/directory. Here you can filter your search to customize for what you're looking for. Definitely make sure you look for primary care physicians that are accepting new patients when you're first enrolling or changing your doctor, and you can also narrow down the search from there. This is the site you'll see when you go to search for providers. It's also important to note that we have a microsite built for the County of Sonoma at choosewha.com/Sonoma-County. On this site, we house all of the plan details that will help answer your questions about Western Health Advantage. We also have a raffle going on right now where you have the option to win either a Bose speaker or a Kate Spade laptop bag. And we don't have too many entries right now, so definitely check out the site, enter your info, and it's a high probability that you could win. We have invited David Pierce from St. Joseph Health here to speak on his slides, so let me hand it over to David.
Thank you, Lauren. My name is David Pierce with St. Joseph Health, and it's my pleasure to be here and participate in this PowerPoint presentation for you to talk a little bit about how St. Joseph Health partners with Western Health Advantage, both our hospitals, clinics, and our medical network, to be able to provide you with some of the highest quality health care being offered here in the Sonoma County region. As you may have heard, St. Joseph Health rolled out its very own medical network about a year ago when we started with 375 physicians in the medical network. Of those, 250 were actual St. Joseph Health doctors, and the other 125 were community doctors around the region. Since that time, in the last year, we have grown to over 600 doctors who are participating in our medical network. That includes, again, specialists and primary care physicians. Most of those doctors are specialists so that you don't have to drive far in order to see a specialist that you need to meet with that is actually part of the network. In addition, most of you probably know that Santa Rosa Memorial Hospital is the North Coast region's only Level 2 trauma center. What does that mean for you? Well, it means that you know you have access to the highest quality trauma care in the area. People from all over the region get flown into Santa Rosa Memorial for any kind of severe heart attack, accident, shark bite, or anything of the nature. As a Level 2 trauma center, it means that the most severe and traumatic cases being seen here in this region are at Santa Rosa Memorial Emergency Room. In addition to that, we offer a state-of-the-art Heart and Vascular Institute and one of the region's leading cancer center. What does that mean for you? Well, it means that if you have some type of heart condition or if there is cancer in your family history, you know that being part of Santa Rosa Memorial Hospital and St. Joseph Health through Western Health Advantage, you've got some of the best care that is available here in the North Bay region. For example, over a year now, we have been performing a new procedure at the Heart and Vascular Institute called Transcatheter Aortic Valve Replacement, or TAVR. TAVR is such a cutting-edge procedure that only 4 hospitals in the Northern California region are performing these procedures to replace an aortic valve without having to perform open heart surgery. Instead, the surgeon goes up through the groin into the artery and with a catheter replaces an aortic valve. These are some of the cutting-edge technologies and procedures that we are performing at Santa Rosa Memorial and St. Joseph Health. On this slide, we see some of the easy access points that members of St. Joseph Health and Western Health Advantage can access their care either in person, without an appointment, or online as needed. For example, those who are looking for a new primary care physician, if somebody is thinking of switching over to Western Health Advantage and wants to easily find a physician that is suitable for them, they can call this patient referral line. And Jan, our patient referral expert, will be able to walk with you through all of the criteria and needs that you have in picking a physician and try to find the right physician for you. And then after choosing a physician, she will actually help you get scheduled for your very first appointment. If you have needs that are urgent, for example, you need prescription medications filled, she can help you find an appointment that meets your personal or particular needs. Once you've established your care with your initial visit, then scheduling your follow-up appointments is simple and easy by either going on stjosephhealthmedicalgroup.com and do your appointments online, or downloading the app and being able to schedule your appointments directly from your phone. A patient portal that is available for you helps you continually be in contact with your care providers by communicating with your doctor's office directly via email, where you can also request prescription refills. You can also access your test results and do appointments online through your patient portal as well. In addition, you have access to our 24/7 nurse advice line that can help you with those difficult questions in the middle of the night or on the weekends and holidays when your doctor's office is not available. Also, if you have need to meet or speak with a doctor directly, you can do a telehealth appointment and have a virtual visit using your mobile device. This is an appointment that would be scheduled at any time, 24/7, and you would meet with a board-certified physician for whatever healthcare issue you're dealing with. These two last easy-to-access services are perfect in a situation as we are going through right now with the coronavirus. We as a health system encourage all of our members to, instead of using the emergency room or urgent care or going into your doctor's office because you are afraid or concerned that you may have the coronavirus, encourage you to use the nurse advice line or do a virtual visit. These are the best ways to speak with somebody about the symptoms that you have and then get their advice as to where to go and where to get tested if necessary. If you need, the last and most convenient service available is our walk-in clinics, either the after-hours care or the urgent care clinics that are spread around the county. Here on this slide, you can see easily accessible urgent care and after-hours care locations. Urgent care would be that care that is an urgent need, needs to be seen today, don't want to go to the emergency room and either wait in an emergency room and have to deal with those kinds of situations and the costs that are associated with emergency room visits. Instead, if it's not life-threatening or limb-threatening, why not use one of our urgent care locations either in Rohnert Park, Santa Rosa, or Windsor, whichever is most convenient for you. These have locations that are open 7 days a week, that are open into the evening. If you have an injury and you want to get it x-rayed, you can go straight to the urgent care, or you can actually call or go on the patient portal and schedule yourself an urgent care appointment. If this is not necessary, it's not such an urgent need, but let's say your child comes home sick from school. Our after-hours care locations would be another level of care, which is more like a doctor visit. You're sick, you have a sore throat, pink eye, or maybe a dermatological rash or something. You don't need to go to the emergency room nor the urgent care location. You just need a doctor visit as soon as possible. These after-hour locations are conveniently located in Petaluma and Santa Rosa with hours that are flexible into the evenings, on the weekends, and on holidays as well. These locations are walk-in clinics where you don't need an appointment. You don't need to see your own doctor. You just need a prescription medication for some type of illness that you're suffering from. On this slide, we can see some of the health education services that you receive as a St. Joseph Health member. We have teamed up recently with the Center for Wellbeing in Santa Rosa to provide free health education services, classes, and programs for those people who are in need of such care. This would be more like a case management type of thing, or if you're just interested in learning how to do healthier cooking. But let's say you've been diagnosed recently with diabetes or with high blood pressure, and your doctor wants you to start taking classes or attending some educational programs. These classes are available for all Western Health Advantage members for free at the Center for Wellbeing, whether it's diabetes education, eating to live healthy, preventing diabetes and heart disease, weight control, smoking cessation, and much, much more. Let's go to the final slide for St. Joseph Health. For those of you that are in the southern part of the county, our Synergy Health Club, which is owned and operated by St. Joseph Health, is available in the northern Petaluma area for anybody who wants to utilize that club. You get some discounts being a St. Joseph Health and Western Health Advantage member. Our Synergy Health Club has been voted #1 health club in the Sonoma County for several years in a row now. That's all I have for St. Joseph Health. Thank you for taking some time to listen to Accessing Your Care with Western Health Advantage through St. Joseph Health. I'll now pass the time back over to Lauren.
Meritage Medical Network is the other network of providers available to you in Sonoma County. As you can see, Meritage has a big footprint across Napa, Sonoma, and Marin counties. And within Sonoma County, they have 75 primary care physicians and 254 specialists. Meritage is a great partner in care, as their model matches the Western Health Advantage model in that doctors are making the decisions about your health care. Their doctors have received numerous recognition and awards for clinical quality, patient satisfaction, employee health, and health technology. They've been operating in the North Bay treating patients for nearly 40 years. Meritage has an excellent care management team. They have a care transition team that can help if you're admitted to the hospital and are transitioning back to home. They have nurses that can help you make sure you stay home. They also have a care management team if you've got a complex condition and need help managing it, something like diabetes or coronary artery disease. They've got nurses on hand to help with that. They also have care coordination for things like transportation to visits or filling out DME forms. And lastly, they have behavioral health care management if you need to access behavioral health and then transition into our Magellan behavioral health program. Okay, this is just an overview of the benefits that are offered by the County of Sonoma. There are 3 different plans, and as a reminder, all 3 plans are $0 costs for you and your dependents. The areas highlighted in red just feature what we've changed to the plan. Otherwise, there have been no changes in anywhere else that's not highlighted in red. The first plan is the Premier 10. That's the traditional HMO plan and is the richest plan. It does not have a deductible. The out-of-pocket maximum is $1,500 for individual and $3,000 for family. And what makes this plan really rich is the fact that you have hospital coverage, lab, x-ray, CT, PET scans, MRIs, all of those are covered in full on this plan. So if you were hospitalized, you would not have to pay anything. Most of your office visits are going to be a $10 copay. And this does have its own unique infertility benefit attached to this plan. The middle plan is the DHMO plan. This is the one where we have lowered the deductible and the out-of-pocket maximum. Originally, the deductible was $1,500 individual and $3,000 for family. So we've dropped that down to $1,000 for individual, $2,000 for family. And again, with the out-of-pocket max, we dropped those as well. The way this plan works is that you pay toward that deductible if you have a hospital stay, if you go into the ER, or if you have surgery. You pay the deductible first, and then you move to where you pay 20% after you've hit your deductible until you've reached your out-of-pocket maximum. So keep in mind the out-of-pocket maximum is always the most you would pay in a calendar year for your services. Anything beyond that, the plan picks up 100%. It's also important to remind you that these are all calendar year maximums. So even if you're making a plan change as of June 1st, you would have this coverage up until 12/31, and then the deductibles would reset as of January 1st, 2021. The third plan is the deductible first HDHP plan. We just slightly raised the deductibles on this plan to $1,400 and $2,800 due to an IRS regulation. I think they only went up about $50 on the individual and $100 on the family. The way this plan works is that you pay the full cost of your coverage up to your deductible. Once you've met your deductible, then you move into where you pay your flat dollar copays that you see listed until you've hit your out-of-pocket maximum. So both the middle plan and the last plan both have the same out-of-pocket maximum. It's just the way that you pay for your services is slightly different between these two plans. The high deductible health plan allows you to open up a health savings bank account, which is not offered by the county. You would open that account up separately from anything offered by the county, but it allows you to put away pre-tax dollars into a savings account that you can use and take with you even if you left the county or if you changed your plan back to the traditional or the DHMO plan. The prescription coverage is quite straightforward as listed here on the chart. For the Premier 10, which is the traditional HMO plan, it's a $5 copay for Tier 1, which is typically a generic prescription. It's a $10 copay for Tier 2, which is typically our brand name prescriptions on our preferred drug list, and a $20 copay for Tier 3, which is the brand name drugs that are not on our preferred drug list. The mail order pharmacy is a great program to use if you've got a maintenance prescription that you foresee yourself taking for an extended period of time. On that traditional plan, you can get a 90-day supply for the same copay as just 1 month, so you would save 2 months worth. For the hospital services DHMO plan, it's a 10/30/50 copay plan, or it doubles when you use the mail order pharmacy program. And with the deductible first HDHP, these copays you see listed are paid after you've met your deductible on the medical plan. Western Health Advantage changed pharmacy benefit managers effective January 1st, 2020 to OptumRx, and the transition went very smoothly. OptumRx has a lot of bells and whistles for our members to utilize. They have access to pharmacists 24/7. They have a website and mobile app prescription management and lots of tools to find pharmacies. They contract with all of the major pharmacies in town, so that would be pharmacies like CVS, Rite Aid, Walgreens, Costco, Target. Lastly, it's a good idea to keep in mind that we also have the Smart 90 program, in which if you're taking a maintenance medication and you wanted to fill at a 90-day supply but didn't want it mailed directly to your home, you could pick up your 90-day supply at either CVS or Walgreens. With the change in pharmacy benefit managers, WHA also took the opportunity to revamp our ID cards. Since we were going to be mailing out new ID cards to our whole membership, we figured we would improve these and make them a harder laminated card, as well as revamping the look on the front. The main thing to note here is that we are no longer listing the primary care physician on the front of the card. We are now directing our members to go online or to the mobile app to confirm who their assigned PCP is. And that way, if you make a change to your PCP, you'll just hang on to the same card and won't need to wait for a new card to come to you in the mail. Western Health Advantage contracts with Magellan Behavioral Health for mental health and substance abuse services. A PCP referral is not required in order to utilize the providers in this network. They have an extremely extensive network of providers and counselors on hand that can help you set an appointment or find a provider in your area. Magellan also offers the option of telehealth, where you don't have to travel to a provider. You can just schedule an appointment with a provider over the phone through video conferencing. The copay for this service would be the same as it would be for an in-office visit. And the best way to find providers is by going to the Western Health Advantage provider directory. It will link you to Magellan's site, and when you do a search for providers, it will tell you whether each provider you look up, whether they accept the telehealth option or are just in person. Western Health Advantage uses Optum for our integrated wellness services. One that's very important to know about is the Nurse 24 line. This is available 24/7, and when you call, you actually speak with a registered nurse that will run you through a list of triage questions to help give advice on whether you should seek in-person treatment or not. So keep in mind this is available at all times. I've used this a lot with my kids before I decide whether to take them into the doctor or urgent care. We also have disease management programs with online tools for our members to access. And this is just extra help from our nurses for those that are managing chronic diseases like diabetes or coronary artery disease. Another program that we offer with all three plans is our chiropractic and acupuncture coverage. Our members love this option. We utilize a network called Landmark, and again, you don't need a primary care physician referral to go to the chiropractor or acupuncturist. You would just go to the Landmark network, starting with Western Health Advantage's website. And once you find a provider, you just go in, show your ID card, and it's a $15 copay, and you have up to 20 visits of both chiro and acupuncture per year. Another perk of being a Western Health Advantage member is having access to Assist America at no extra cost to you. This is in place if you're traveling more than 100 miles away from home and you have an emergency. It could be something very minor like you forgot your prescription, and Assist America, I know, has helped people refill their prescriptions at the pharmacy closest to where they're located while they're traveling. They can also do things like medically evacuate you out of a dangerous area, help you with your lost luggage. They can help arrange for care of minor children if you're hospitalized and you can't watch your children. They can help you find the closest ER or arrange for a translator if you're in a foreign country where you don't speak the language. So it's just a great service to know you have on hand. And when you become a member with us, you would receive a separate little ID card that has their phone number. They also have a great mobile app that you can download, you log into, and once you're in there, there's just a one click to call Assist America. So anytime you're traveling, you can just get on that app and call them, and they will connect you and get you set up with services right away. Our partnership with Active and Fit Direct brings over 11,000 fitness centers directly to you to access. This is only $25 a month, and you can access any of the gyms in their network. So they give you lots of choice. There's gyms like Crunch, Anytime Fitness, Curves, a little bit of the smaller gyms, but you could have one close to your house that's a Crunch and one that's close to your work that's Anytime Fitness, and you can access anything that's in their network. So it's really a great deal for just $25 a month. When you are a member with Western Health Advantage, we always encourage you to go online, create an account with mywha.org. Here's where you can access your copayment summaries. You can change your PCP online. You can order replacement ID cards or print temporary ID cards, access your evidence of coverage, all of those types of things. We also have a mobile app that you can pull up, and it will show your ID card and your benefits. It has a feature that allows you to click a button to email or fax your ID card over to your provider if they need it. So definitely get online. That's where we're always directing members to go so we can stay green, and it's going to have the most information at your fingertips. Thank you so much for joining us for this webinar today. Again, my name is Lauren Bayat, and Chris Jordan is also the account rep that works with me for the County of Sonoma. We are both here dedicated to help you with anything you may need on your plan. And as a reminder, I encourage you to go to the microsite we've built, choosewha.com/Sonoma-County. Check out the information on there. Make sure to enter into the raffle prize, and please give us a call if you have any questions at all. Thanks again for joining.